During this Alcohol Awareness Month, we take a close look at the serious problem of binge drinking. The sobering fact is that 1 in 6 adults binge drinks about 4 times a month, and the latest national figures also show that sadly more than 1,700 college students in the United States are killed each year as a result of alcohol injuries. Binge drinking is very common among patients who seek emergency care, and we're pleased to have back with us Dr. Carolyn McClain with the Urgency Room to talk about this binge drinking and overindulgence of alcohol. So what are you seeing in the urgency room? What's bringing them in?
So most of the time it's injuries that you sustained while drinking. And on my way here, I was thinking about some of the more recent ones I've seen. And one woman, she wasn't drinking excessively, probably 2 drinks. She was swing dancing. She fell, and she broke her back.
Oh.
It's just your balance gets off when you drink. And then I had another gentleman recently who was drinking at home, slipped and fell, and landed on his fireplace tools, and he sliced off part of his nose.
Oh my gosh.
And he wasn't doing anything out of the realm of what we all do when we're at home with our family and maybe having a couple drinks, but you lose your balance, and so most of the time what we see are injuries from alcohol.
You know, I think that question is and I know it varies from individual to individual, but what is considered binge drinking? I think some people may be surprised what that means.
So really binge drinking is drinking too much in a short amount of time. So if you drink as a woman 2 drinks an hour, or as a man 2 or 3 drinks an hour, but it does depend on your size.
And how much you've had to eat, or you're not eating, or... Right?
So yeah, if you have food in your stomach, it delays the absorption of the alcohol. So even if you drink quickly, it doesn't absorb quickly. But if you don't have any food in your system, you're going to absorb that alcohol pretty quickly. And the other thing is sometimes you drink 2 or 3 drinks and you get a buzz, but not all the alcohol has been absorbed yet. And so you may continue drinking, not knowing that you still have 2 more drinks to absorb in your stomach. And that's when people drink too much and pass out and have the complications of drinking too much.
You know, and I was thinking that people might think, well, I'm just going to have a couple of beers, but then they have something else, and it's like before they know it, they've. And does it just take one time or multiple times to have unintentional or intentional injuries from it?
Oh, well, you know, I mean, if you binge drink regularly, you're very likely to have an unintentional injury. But it just takes one time. I mean, it's your balance gets off, your judgment is off. You think, oh yeah, you know, I'm 45 and I can walk on that balance beam right now, and you probably couldn't before
yeah,
you
really.
were drinking, but your judgment's off, so you do things that you probably wouldn't do sober. And the problem with drinking is you plan on having 2 drinks, but then your judgment is impaired and you think, oh, I'll just have one more.
Or you have a friend or someone saying, oh, just have one more.
Or someone just keeps refilling your drink without you really being aware of it, and then you drink too much.
And basically when they're binge drinking, it's alcohol poisoning, right? That's what they're doing to their bodies?
Yeah. So all of us have the same metabolism of alcohol, so it doesn't matter how much you drink, you're going to metabolize it the same. So if you are 0.08, which is the legal limit, you're going to metabolize to 0.05 in an hour to an hour and a half. So you're going to go down at the same amount, regardless of how much you drink or how often you drink.
What would be some of the other injuries that you can incur to your body? I mean, what happens when you're binge drinking to our bodies themselves?
Yeah, so you have, a lot of people will get vitamin deficiencies from binge drinking because it prevents the absorption of your vitamins.
Didn't know that.
Alcohol is a toxin to your gastric wall, so you can have, we call them GI bleeds, but you can bleed in your stomach from this, and people will throw up blood. if you binge drink, if you're genetically, if you have a genetic predisposition to pancreatitis, you can get pancreatitis just from binge drinking a few times. And pancreatitis is a severe epigastric pain that will cause a lot of vomiting and takes several days to heal. And the treatment is not eating anything, and that's pretty difficult for all of us.
Oh my gosh.
That's very common after binge drinking.
We had talked about in the past holiday heart syndrome, and what is that exactly?
So holiday heart syndrome is when you drink too much and it actually has a toxic effect on your heart. So it causes something called atrial fibrillation. Now your heart normally will push and pump all of the blood out of it with each squeeze. But with atrial fibrillation, it's just a really light squeeze, and so a lot of the blood stays in your heart. So your heart has to beat faster, it beats erratically, and you're not getting enough blood flow to your system, so you'll be quite tired and lightheaded. And eventually it can cause, if you have that for too long, it can cause heart failure.
Wow, that's pretty scary. And then what about if you're a diabetic? A lot of people.
Yeah, so if you're a diabetic, if drinking inhibits your liver's control of your blood sugar, so your liver is there, it stores a bunch of blood sugar so that if your blood sugar gets low, it puts more sugar into your system. But if your liver's busy detoxifying alcohol, you might get extremely low blood sugar, and this is especially true in kids who drink. So the younger you are, the less likely your liver is going to be able to tolerate large amounts of alcohol.
Oh, interesting. So when should someone go to the urgency room or the emergency room if they've been binge drinking?
So most of the time, people are brought in by their friends or by ambulance. And that's because usually when you've been drinking, so have your friends. So nobody wants to have you drive. But if your friend has drank enough that you feel like they might pass out, passing out is a sign that you may not be able to control your airway. So how do people die from alcohol poisoning? They basically stop breathing or they vomit while they're passed out, and that vomit gets into their lungs, and that's acid in your lungs, and we can't fix that. So that's, we have so many famous people that have died that way. But that's mainly how people die, is that they stop breathing and that they vomit while they're passed out. And so if you have a friend that has drank too much, just bring them in to be watched. It's not worth it. Or if you've been drinking, call 911 and have them. And even
because
the
it
police
truly
will
is an
bring,
emergency.
yeah.
It's life-threatening.
Yeah, and the police, you can call the police too, and they'll bring your friend in, and nobody gets in trouble. It's the right thing to do.
Absolutely. Final comments about binge drinking for our viewers?
I think the most important thing to remember is that it's really common. It's not just something that you have that you see in college students. It's something that happens no matter how old you get. And the thing that always surprises me about alcohol is, at this point I'm 45, I feel like I've kind of passed the point where I might become an alcoholic, but that's not true. At any point in your life, no matter how old you get, alcohol can be a problem for you. So just treat it with respect. Think about it before you drink. Try to plan before you go out. Make sure you eat a big meal before you drink so that the risks aren't as high. And maybe have a friend with you that can make sure you're okay.
And if they want more information, they can go to your website,
Yeah.
the urgency room.
Yep.
Great,
Thanks.
great advice as always. So it's always a pleasure to have you with us. So
Thanks
thank
for
you,
having me.
Dr. McClain.